Crazy Dr. Krause here with a segment about the immune system. That's the body's defensive system. Think about a football game with a big D and the white picket fence. Defense, defense, defense. It provides protection to the body, and it has, and this is a great example of the rule of twos that's talked about in Super Simple. It's got two divisions, innate and adaptive. Adaptive is also called acquired. So the innate immune system, that provides general defense, general immunity. We're born with it, and it provides immunity for a wide variety of potential hazards rather than one specific one, which the adaptive immune system defends against. And guess what? Innate immunity has two subcategories, barrier and non-barrier. The names are self-explanatory. An example of innate barrier immunity, the skin that provides immunity in a barrier fashion. Mucous membranes that line open body cavities. So nasal cavity as an example, lined by mucous membrane. That's a part of the barrier innate immune system. Non-barrier would be things like mast cells or natural killer cells or the complement sequence, which again provide defense or protection against a wide variety of things, of agents. So innate immunity, barrier and non-barrier. Then there's adaptive or acquired immunity. And there is a great flow chart. Let me look it up here. Great flow chart on page 276 in the first edition of Super Simple, figure 26.1, that shows acquired immune system or acquired immunity flow chart. And this is a system or a part of the immune system that has the ability to recognize or differentiate self from non-self. What belongs to me? What belongs to you? And it does that by recognizing antigens, which are protein molecules generally, antigens on the surface of cells. So it can recognize things that are foreign, that are non-self, and respond to that. That includes something like a transplanted organ, a kidney transplant. The body will, even if it's well tissue typed, have a tendency to recognize that as non-self, want to produce antibodies, also a protein molecule, that will destroy that transplanted organ. And so organ transplant patients postoperatively have to take some combination of immunosuppressive drugs for the rest of their lives, which helps minimize the potential of the body rejecting that transplanted organ. So acquired immunity differentiates or is able to tell self from non-self based on surface antigens. If it's self, the system doesn't respond. If those antigens are non-self, so blood typing is a good example. So somebody who's type A and inadvertently or in error receives type B blood, the recipient's acquired immune system is going to recognize those red cells from type B based on surface antigens as being non-self and will produce antibodies to destroy those red cells, creating antigen-antibody complexes, and the red cells will clump together, can cause some clotting problems. That's why we type blood. The acquired immune system, as you would guess, has, guess how many? two subdivisions, active and passive. The active acquired immune system produces antibodies inside the body, endogenous antibodies. So it would be my body producing antibodies internally. It would be your body producing antibodies inside your body. Those are endogenous antibodies. And passive is the second type, and that's where antibodies are exogenous, coming from outside the body. They're produced outside the recipient's body, but gain entry to the body. And as you might guess, there are two types of active acquired immunity and two types of passive acquired immunity. Active, the two types are natural and artificial. Natural acquired immunity would be the actual exposure to a virus or a bacteria, like exposure to the coronavirus, the COVID-19 virus, and the body would recognize that as non-self and start to produce antibodies to fight that invading virus. That's natural active because they're endogenous antibodies. They're being produced inside the body. Active artificial acquired immunity would be a vaccination. So you get a flu shot, and that stimulates your body to produce antibodies or to be revved up, made ready, prepped to make antibodies if exposed to whatever type of flu the vaccine would cover. There are a number of different types of flus. And then passive, two divisions, natural and artificial. Natural passive immunity is what the baby acquires by nursing, breast milk. Mama's milk has lots of antibodies in it, and those are ingested by the infant and helps improve their immunity. That's why breastfed babies are generally healthier than non-breastfed babies. So that's natural passive acquired immunity. Artificial passive acquired immunity would be a shot of gamma globulin. So you get an inadvertent needle stick in a hospital setting. You go to the employee clinic, and they will give you a shot of immunoglobulin, antibodies that were produced by somebody else and then harvested. That's what plasmapheresis, these plasma businesses that you'll find around many colleges, for instance, and they pay individuals to donate their plasma a couple times a week. They take that plasma, sell it to pharmaceutical companies who refine it and turn it into gamma globulin that can be sold to hospitals, healthcare facilities to provide acquired passive artificial immunity. The antibodies are exogenous. They're produced outside the body. So there's the defense. There's the immune system. You need to know innate and acquired and the different parts of each innate and acquired. I'll see you next time. Right now, Kraus out.